Module 3. Psychoactive Drugs and Treatment of Disorders. Our journey into the realm of psychoactive drugs takes us to the streets of bustling cities, the serenity of therapeutic clinics, and the core of human physiology and psychology. These substances have played myriad roles in human history, from ceremonial rituals to medical marvels and, unfortunately, also as agents of abuse and dependency. Dive with me into the rich history of two potent stimulants, cocaine and amphetamine. Once hailed as wonders of modern medicine, their stories are interwoven with societal shifts, cultural values, and scientific discoveries. Cocaine, originating from the coca plant, was historically used by South American indigenous cultures and rituals, and as a stimulant to combat altitude sickness. Amphetamine, synthesized in the late 19th century, was once marketed as a nasal decongestant. The paths of these two drugs converged in the 20th century when they became popular recreational drugs. The appeal? Their intense euphoric effects and the burst of energy they provided. Over the years, as the recreational use of these drugs surged, so did the understanding of their dangers, leading to stringent regulations. Yet, while their histories have similarities, their actions within the human body differ. Imagine the brain as an intricate railway system. Neurotransmitters are the trains carrying messages between stations' neurons. Cocaine acts like a barrier, preventing these trains from returning to their original stations. This leads to a buildup of neurotransmitters, especially dopamine, causing heightened feelings of pleasure and increased energy. Amphetamine, on the other hand, pushes more trains onto the tracks while also blocking their return. While both drugs amplify neurotransmitter levels, they achieve it through slightly different mechanisms. From stimulants, let's shift gears to a more subdued category, depressant drugs. These substances, rather than ramping up activity, slow things down. Picture them as a cozy blanket, wrapping the brain in a calming embrace. Drugs like barbiturates, benzodiazepines, and certain sleep medications all fall under this category. While they differ in their specific effects and uses, they share a common trait. They depress or slow down brain activity. For someone like Harriet, who's been tossing and turning at night, a barbiturate, particularly in a higher dose with short-acting effects, might just offer the solace of sleep she desperately seeks. Now, consider a category of substances often overlooked in discussions on drug abuse, inhalants. These are volatile substances that produce chemical vapors, inducing a high when inhaled. The sources can be surprisingly mundane, from glue to paint thinners to certain aerosol products. The allure of inhalants, particularly among certain demographic groups like poor Hispanic and Native American youth, lies in their accessibility and low cost. But the dangers? They're profound, ranging from brain damage to heart failure. Beyond the realm of drug effects, the human psyche presents its tapestry of conditions. Anxiety disorders manifest as intense, prolonged feelings of worry or fear. Imagine being trapped in a room with an ever-loudening alarm, with no off switch. That's anxiety for many. On the other end of the spectrum, we have mood disorders, like depression, which can feel like being engulfed in persistent, overbearing fog. And then there's schizophrenia, a condition where one's perception of reality can distort, leading to hallucinations or delusions. Treatment for these conditions often involves psychoactive drugs, but understanding their precise mechanisms is like trying to solve a puzzle with ever-shifting pieces. Consider antipsychotic drugs, which are used to treat conditions like schizophrenia. Theories suggest they work by blocking certain neurotransmitter receptors in the brain, but the exact pathways and mechanisms remain elusive. It's a testament to the intricacies of the human brain and the challenges in fully grasping its nuanced operations. Meet Archie, struggling with the depths of depression after a personal loss. To lift him from this abyss, his doctor prescribed a medication from the category of monoamine oxidase inhibitors. An oxidase inhibitor is a type of drug that inhibits or reduces the activity of an oxidase enzyme. Oxidase enzymes play a role in the oxidation of various substrates in the body. By inhibiting these enzymes, specific biochemical reactions can be modulated or controlled, offering therapeutic benefits for certain conditions. A well-known subclass of oxidase inhibitors is the monoamine oxidase inhibitors. These drugs inhibit the monoamine oxidase enzyme, which is involved in the breakdown of monoamine neurotransmitters in the brain. such as serotonin, dopamine, and norepinephrine. By inhibiting this enzyme, they increase the availability of these neurotransmitters in the brain. These were among the first class of antidepressants to be developed and were commonly used to treat depression. They can still be prescribed for depression that doesn't respond to other treatments, and for certain other conditions, but they're used less frequently today because of concerns about interactions with certain foods and other drugs. So, Archie's relief came with a caveat. Archie had to avoid certain foods, especially those rich in tyramine like aged cheeses. Why? The interaction between the drug and tyramine could lead to dangerous spikes in blood pressure. In navigating the multifaceted world of psychoactive substances, we traverse through history, delve into the intricacies of the human brain, and grapple with the profound impacts on society. From the highs of stimulants to the calming embrace of depressants and the mysteries of psychiatric medications, it's a journey that underscores the delicate balance between benefit and risk, understanding and mystery.